Throughout your pregnancy, you'll be hearing a lot about how your health affects your baby's health. Now researchers have discovered that women with periodontal disease may be 7 times more likely to deliver a preterm low birth weight baby than women with healthy gums. Scientists believe the link between periodontal disease and preterm birth is due to the body's reaction to the bacteria that exist in gums infected with even mild periodontal disease. Periodontal disease is caused by the bacteria that live in the plaque that forms constantly on your teeth. The bacteria infect the tooth roots and cause pockets of infection to form in the gums. Gums infected with advanced periodontal disease can be compared to a 9 square inch open wound around your teeth, offering significant opportunity for harmful bacteria to enter your blood and travel throughout your body. Your body reacts to this infection by producing prostaglandins, a natural hormone-like chemical. This is important because during a normal pregnancy, the level of prostaglandins produced by your body gradually increases and then peaks when you go into labor. If extra prostaglandins are being produced in response to an infection in your gums, one theory is that your body may interpret this as a signal to go into labor, and your baby could be born too soon or too small. Unfortunately, preterm babies have a higher risk for disease and disabilities such as breathing and lung problems. The good news is that you can prevent periodontal disease and reduce your risk of having a preterm baby by flossing daily and brushing your teeth after each meal with a soft bristled toothbrush and fluoride toothpaste. If toothpaste makes you feel nauseated, you can brush with plain water and rinse with an anti-plaque or fluoridated mouthwash. Make sure you also come to see us regularly so we can clean your teeth as needed and monitor the health of your mouth.